CT junction motion analysis. Okay, for the CT junction, if we have the patient in the seated position, we can use our thumb on the transverse processes, and for rotation, we can cause rotation from my thumb bringing the shoulder back on the left, and my fingers kind of just helping control the shoulder on the right. If I put my thumb on the transverse process of T1, T2, T3, I can feel for the rotation. If I want to check on the other side, I can check T1, T2, T3. If T2 fails to go forward compared to T3, or if T2 is left rotated, we want to create positioning such that we can move T2 on T3. If we turn the head this way for the setup of the adjustment, that's going to help T2 go forward, and so that's going to help for T2 left rotated. If we take our contact on T2 and we turn our head this way, then the movement is going to be T1 going backwards on T2. Okay, so it's always important to consider the biomechanics when you're doing the adjusting. So in this case, we want T2 to go forward on T3, so we're going to lay the patient down and turn her head to the right. So face down, please. We'll have her on a narrow table that's low so I can get over my work. I'm going to have her turn her head slightly, just enough to squish her nose a little bit. And I'm going to try to get on the skin contact here, and I'm getting lateral, wide lateral, because my piezoform needs to be lateral so you get a longer lever, which makes this adjustment way easy. Okay, I get up over my work, my hand and arm, or my arm and forearm are nice and straight. Okay, I can use my fingers if I want to help the rotation. Otherwise, I can just reinforce over the top of my contact. I traction medial to lateral to allow for some right rotation to occur. You can do it on the end of expiration. Patient breathes in, all the way out, loose, down, down. At the end, there's a slight body drop. There's not a big elbow impulse. If you do big elbow impulse translatory movements, it tends to be uncomfortable and the patients don't like it.